Fibromyalgia is a disorder of chronic widespread pain and tenderness, and it typically presents in young women in the third decade or middle-aged women, but can affect patients of either sex and at any age. Fibromyalgia is a diagnosis of exclusion and often occurs in patients with other conditions such as autoimmune inflammatory arthritis and osteoarthritis. And the clinical evaluation may review objective evidence for other comorbid illness such as hypothyroidism, rheumatoid arthritis, systemic lupus erythematosus, polymyalgia rheumatica, and other inflammatory or autoimmune disorders. No clear pathophysiological mechanisms for fibromyalgia has been established, but evidence suggests that there is abnormality in central pain processing. Although there is no cure for fibromyalgia, treatment can relieve some of the symptoms. And since symptoms are numerous and varying among patients, treatment programs must be individualized for each patient. The treatment includes patient education, stress reduction, regular exercise, and medications. And always combine pharmacological and non-pharmacologic therapy in the treatment of fibromyalgia. Cause usually unknown. The symptoms are chronic widespread pain, unrefreshing sleep and tiredness, anxiety, depression, migraine or tension headaches, numbness or tingling of different parts of the body, abdominal pain, constipation or diarrhea, irritable bladder. The signs that are usually elicited are tender points that's commonly found around the elbows, shoulders, knees, hips, back of head, in the size of the breastbone, and also myalgia more than 3 months. So the investigations are FBC, ESRB, creatinine, urinalysis, thyroid stimulating hormone level, 25-hydroxy, vitamin D level, vitamin B12 level, iron studies, magnesium level. The main treatment objectives are to relieve pain, to aggressively treat comorbid depression, to improve sleep, to reduce fatigue. And non-pharmacological treatment includes stress management, exercise, balanced diet, sleep therapy, psychological or behavioral therapy. And pharmacological treatment, for the treatment of mild symptoms, first-line treatment, give paracetamol in adults 500 milligrams to 1 gram, 6 to 8 hourly as required. In children 6 to 12 years, give 250 to 500 milligrams 6 to 8 hourly as required. And 1 to 5 years, give 125 to 250 milligrams 6 to 8 hourly as required. And 3 months to 1 year, give 62.5 milligrams to 125 milligrams 6 to 8 hourly as required. Or you can give diclofenac oral in adults 50 milligrams 8 hourly or 100 milligrams 12 hourly as required. In children more than 12 years, give 50 milligrams 12 hourly as required. Less than 12 years is not recommended. Or diclofenac rectal in adults 100 milligrams 12 hourly as required. In children more than 12 years, give 75 to 100 milligrams daily as required. And less than 12 years is not recommended. Second line treatment, give tramadol oral 25 milligrams that, and then you increase by 25 to 50 milligrams daily up to 50 to 100 milligrams 6 hourly as necessary. The maximum dosage of 400 milligrams per day. And then you give amitriptyline oral 10 milligrams knocked, that's in the night, and then you gradually increase to 75 milligrams daily as required. And the treatment of chronic or severe symptoms with anxiety, you treat as I mentioned with tramadol, and increase the dose, and also you give the amitriptyline. And then for first line treatment, as for the treatment of chronic and severe cases with anxiety, give clonazepam oral in adults 250 micrograms 12 hourly with a maximum of 1 milligram 12 hourly. In children, is not recommended for this condition. And for the treatment of chronic or severe symptoms with depression, first line treatment, you give fluoxetine oral; in adults 20 milligrams daily with a maximum of 80 milligrams per day; in children 8 to 18 years 10 milligrams daily with a maximum of 20 milligrams per day. Less than 8 years is not recommended. Well, you can give amitriptyline oral; in adults 25 to 50 milligrams once daily, that's early evening, and then you increase by 25 milligrams daily, 3 to 5 days, up to a maximum of 150 milligrams. And children more than 16 years, you give 5 to 15 milligrams 12 hourly, and less than 16 years is not recommended. Or you can give duloxetine oral; in adults 20 to 30 milligrams 12 to 24 hourly, and a maximum dosage of 60 milligrams per day. In children 7 to 17 years, we give 20 to 30 milligrams daily with a maximum of 60 milligrams per day. And for the treatment of chronic or severe symptoms with myalgia, first line treatment, you add these medications to the medications already mentioned. So you give tizanidine oral; in adults 2 milligrams 8 hourly, you may increase to 4 milligrams 8 hourly after 7 days. In children is not recommended. Or cyclobenzaprine oral; in adults 5 to 10 milligrams 8 hourly as required; in children 5 milligrams 8 hourly as required. For the treatment of chronic and severe symptoms with neuropathic pain, you treat the mild symptoms, and then you add pregabalin oral. That's a first line treatment. In adults 50 to 75 milligrams 12 hourly till resolution, and a maximum of 300 milligrams per day. In children is not recommended. You can give carbapenem oral; in adults 300 milligrams daily, and then you increase by 300 milligrams daily to a maximum of 600 milligrams 8 hourly. In children is recommended. For the treatment of chronic or severe symptoms with migraine, you treat the mild symptoms, and then you add clonidine oral; in adults 50 to 75 micrograms 12 hourly. In children is not recommended. Referral criteria: so you refer patients not responding to treatment to the appropriate specialist.